Hi, my name's Mariah. I'm going to be your nurse today.
Hi, Mariah.
Can I have you come sit up here for an examination?
Yes.
So you want to note that her physical appearance seems to be clean. She doesn't have any major lesions that we should be worried about. You want to note that her body structure, her weight is indicative of her height and age. And you want to note that her mobility does not seem to be impaired because she was able to sit without any assistance. And you also want to take into consideration that her breathing is fine and she doesn't seem to be any pain or discomfort. So we're going to start with an eye examination if that's okay.
Sure.
So I want you to start by reading the first 3 words of this line if you can.
Over 200 catechumens.
Now can you cover one eye and read the next 4 words?
And candidates presented to
Now cover the other eye, please, and read the last line.
Bishop Foy's in 2 ceremonies at the Cathedral Basilica.
Thank you. And next I'm going to be looking at her eyes and noting noting the structures of her eyes. So her eyes seem to be symmetrical and appropriate to the size of her face. Her scleras are white and her irises are the same color and her pupils are the same size. So I'm going to pull down and can you look up for me? Her conjunctiva seems to be pink, which is a good thing. All right, and now we're going to test for accommodation. Can I have you focus on something over there? And when my pen comes to you, I want you to look at it and focus your eyes on that. All right, and you should see that the pupils constrict at the same rate. Next, we're going to do the 6 cardinal fields of gaze. So I want you to follow my pen. And you want to notice if there's any shaking of the eyes, which there doesn't seem to be. And next we're going to do a cover test. So I want you to focus on something in the distance and I'm going to cover one of your eyes. And you want to notice that this eye, the uncovered eye, is not shaking or moving as you cover the other one. All right, and now we're going to do a pupil dilation test. So I want you to look at me. And as you shine the light in the eye, you should notice that both of the pupils constrict at the same rate. All right, very good. All right, next I'm going to do a test on your lungs, okay?
Sure.
All right, so we want to start by noticing that the patient is not having any trouble breathing. She's not hunched over, trying to catch her breath. She seems to be able to take in good deep breaths, and you want to notice that her respiration is around 14 breaths per minute, which is normal. So I'm going to be doing her AP diameter, and with your AP diameter, you want 1 of her sides to be 2 of her backs, which it seems to be, which is according to ratio, which is good. Next, I'm going to be palpating and for her chest expansion, so I'm going to put my hands on her back and I'm going to ask you to take a big deep breath. And you should notice that the thumbs move at the same rate, so that is a good thing. And next I'm going to palpate for tactile fremitus, so each time I put my hands on your back, I want you to say 99, please.
99, 99, 99.
And you should feel the vibrations on your hand each time you do it. And next I'm going to be percussing. So when you percuss, you want to make sure you get in the intercostal spaces. You don't want to percuss on the bone, or that's how you're going to hear dullness. You want to get in the spaces so it can be resonant. And next I'm going to be auscultating, so each time I place the stethoscope to you, I'm going to want you to take a big deep breath, okay?
Sure.
each time you're hearing these breath sounds, you want to make sure you're not hearing any crackles or any wheezing, which I don't seem to be hearing, which is a good thing. Sorry. And next we're going to be listening for your the voice sounds. So each time I press my stethoscope to you, I want you to say E when this is a egophony test.
E, 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 E.
And each time you do that, you want to make sure you're hearing that E sound and not hearing like an A or any type of other vowel sound. All right, so next we're going to move to the front. So another thing that I forgot to mention is when you're first assessing, you want to make sure that there's no bulging of the thorax and there's no indentations in the chest or anything like that. So you also want to notice again that she's not having any trouble breathing. She's not hunched over, so she's able to get good deep breaths in without needing any other type of support. So I'm going to palpate for tactile firmness again. So each time I press on your chest, I want you to say 99.
99, 99, 99.
And we're going to auscultate from the front side, if that's all right. So I want you to take a big deep breath each time I press the stethoscope to you. And while sometimes it's easier to do it over the close, some patients prefer to, or under the close, some patients prefer to do it over. But again, I don't seem to be hearing any crackling or wheezing, so her breath sounds seem to be good. Thank you for letting me do a physical examination on you.
You're welcome.